If you have a medical emergency and you are unable to communicate, you can still be a critical partner in your treatment and recovery. It comes down to doing one simple yet potentially life-saving thing.
And that is making sure you carry your most important card in your wallet. And we're not talking about credit cards.
We'll tell you exactly what we're referring to in this week's Health Talk, and we're up next. Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. We're so pleased to have Bob Bepko back on Health Talk today. He's the Administrative Director of Pharmacy Services at the Western Connecticut Health Network.
Great to have you back, Bob.
Thank
you. Always have
Thank you.
Wonderful information to share because it's so practical for folks at home and it affects almost everybody.
Almost everybody.
So today we're going to talk about knowing your medicines and using a medication card.
Yes.
And that's the most important card in your wallet.
Yes.
What's a medication card?
A medication card, it's a small card. I have a sample here. I don't know if they can see that.
You just hold it in your chest
Yeah, show it to us.
in front of you.
How's
Perfect.
that?
Great.
Okay, a simple card.
It's the size of a credit card.
Exactly. That actually fits in your wallet. And on that, your name, address, phone number, and the list of your medications. How many times have you driven down the road and you've heard an ambulance come flying by you? That person's probably going to the emergency room and may or may not be conscious. And you've got to start, the physicians in the emergency room have to start treating this patient. Well, a good way to start that treatments is they need to know what kind of medications you're on. If you're unconscious, if you don't have a family member with you that can talk about your medications, you can have some issues. If you're on, say, a drug like warfarin or Coumadin, and you fall, you break a hip, you've got a brain injury, you hit your head first, you could be bleeding internally. So how do we treat that? How do we
even begin to suspect it?
Exactly. How do we get the blood to stop? And if you have a list of your medications on you, and they see that you're taking warfarin or Coumadin, they can react fast and treat that.
And that includes over-the-counter medicines as well as.
Yes, it does.
So if you're taking an aspirin a day, or you take Advil, 2 tablets 4 times a day, that should be on the card too.
That's got to be on the card also, because that can affect, everybody I shouldn't say everybody, lots of people take low-dose aspirin to improve their cardiovascular, their blood system. And if you do take that low dose every day, and you may notice if you're a male and you're shaving your face daily, or if you're a female and you're shaving your legs, and you nick yourself, and just, boy, that aspirin is working. It's taking me a little bit longer. Exactly. Exactly.
And so in the setting of significant trauma, that can be an important thing.
It's very important.
I can't agree with you more strongly. A patient comes into the emergency room doctors, as a general rule, maybe we should say something about, don't have access to your medical record.
That is correct.
Why don't they? We have all these computers. Everybody thinks, they say, well, I've had patients say this to me, just look it up. Why are you asking me this question? Why don't we just look it up?
Different hospital systems could have multiple computer systems in their network. Your physician's office has a different system also. If you go to your orthopedics, he's got or she's got a different system in their office, and unfortunately, nothing talks to one another.
So in other words, I can't go from the emergency room, call up your record from your primary care. Sometimes, I shouldn't say, but oftentimes can't call that record up and see what's going on.
Right.
You're starting pretty blank.
We're starting to make progress in that area where a physician associated with a particular hospital will have access. They'll be on the same system, but we're not there yet.
And that brings up another point. It may not only be emergencies when you're in an ambulance, but if you're traveling,
yes.
if you're in a different city or state where your health system is not located, you may have something that's important enough you need to see a physician, but may not be an emergency. You still need that list of medications.
You still need that
Because
list.
even within the same system, when you just see a different doctor who may not have the same medical record, knowing medicines is so important, and trying to remember them, I think, is a fool's errand.
Relying on memory is very imperfect.
What dose of Synthroid are you taking? Oh, well,
Well, it used to be
used
this,
to be.
and it was that.
right, but it's purple now, and you know you got to have the strengths, and you got to continually update that.
Yeah, so exactly what should go on the card?
You should have the name of the medication.
Brand versus generic, does it matter?
Either or, because your healthcare professionals will know. The dose,
The exact dose.
the exact dose,
Not one pill.
right, exactly.
You want it in mg or
Yes.
grains, or not too often in
And-
grains anymore, but in milligrams.
Right, and how many times a day you're taking it.
Okay. And for every medicine. So if I'm taking a baby aspirin once a day, it should say aspirin 65 milligrams once daily.
That is correct.
Even the time of day might be helpful. If you're taking, I think, diphenhydramine or Benadryl, 25 milligrams at night, you should write at night.
Yes, yes. The time that you take it, you should have that there
You
also.
know, the more details, the better.
Because it can get confusing.
And again, if you're taking over the counters, if you're taking supplements, write those down too.
Yeah.
Right.
Having all that information will
helpful to
never
put-
be a bad thing for your
It's
healthcare
never a
provider.
bad. The more information you have is not a bad
So
thing.
it may be helpful to have somebody write down blood pressure pill, thyroid pill. I mean, the doctors may know that. But there are some pills that are used for lots of different things. So I can foresee instances where somebody's getting a certain drug that might be for anxiety or to slow down a heart rate, and it might be for angina.
Yes.
And so it might be useful to write down the
Why
reason
you're
you got
taking it.
this.
Why you're taking it.
That
And-
can especially be important in an emergency. It may be useful to have a separate list of your medical conditions and your doctors, but if you have on the card, you're taking this for this condition, that at least clues in those
Yes.
doctors as to some of the medical conditions you
What
have.
what they have to take in mind when they're trying to come up with a treatment for your emergency situation.
What about allergies or bad reactions to medications?
That's a tricky, because a lot of people, you know, if you take a medication, you're supposed to take it on a full stomach, take it on an empty stomach, and you've got a stomach ache. Well, I must be allergic to it. Well, you know what? You're not allergic to it. You didn't follow directions. Take it with food, and it won't bother you. But
side
don't
effect.
say that's an allergy, because you have the opportunity to treat certain disease states with a medication. And if you say, "Oh, I'm allergic to that," we may have to go to something different, and it may
Less
have
effe-
more
less effective.
less effective, more side effects.
I think that's really important. So when you're thinking about bad reactions, if you're writing down, write down what the reaction
That is correct.
was.
Yeah.
Because especially in an emergency, if it was some nausea, it still may be worth giving that medication. If you had anaphylaxis,
That's a different
Which is
story.
shock.
which
Right.
is shock, and that's a different story.
Trouble breathing, yeah, that's a
No,
different.
that's something that I think we all struggle with as doctors with our patients, is that the difference between side effects and allergies. And allergies can be life-threatening, so we're certainly not going to give you a drug to which you're absolutely allergic. If you had a side effect from a drug, well, those don't happen all the time. That drug may be very important in your care, and we may want to give it. So I think people need to be careful about
Very
saying
careful.
I'm allergic to something. And I think that I think they ought to discuss this with their doctor. If you really think you're allergic to penicillin, have that discussion and see whether the doctor agrees that that's an allergic reaction.
Right. And because oftentimes you'll get patients, well, I'm allergic, I can't take any of this, I can't take any because I'm allergic to it all. But then when you sit down and you go through the process, they're really not allergic to it. And come on, we're here to help you. You know, this drug is going to work, and it's got the least amount of side effects.
And Bob, in terms of this card, shouldn't they tell their loved ones who might be coming to the emergency room where it is that they have such
Yes.
a card? Say something about that.
And it's important that your significant other, your husband, your wife, or your children know what medications you're taking, and they're part of your health advisor, so to speak, because they have to translate, they have to tell the physicians what you've been doing, what you've been taking. You can't be there on a gurney being a mystery with nobody, people not knowing what kind of medications you're taking.
It just creates so many more steps to go through.
It may delay treatment.
And that can save your life or not.
That's correct.
What do you advise patients about best practice when they are started on a new medication, or an old medication is stopped, or a dose is changed?
I would think that it's important that you do keep available past medications that you took, because you can see the physicians will know that, well, they tried a particular dose of, like, say, lisinopril for high blood pressure, and the 10 milligrams didn't work, 20 milligrams didn't work, so they either decided to add another medication to help that out or discontinue the lisinopril altogether. But it's important for that past history.
So ideally on the card or your record, you'd put a line through it and then say
Stopped.
discontinued and the date.
Right.
In this modern era where most people carry cell phones, which you can put almost an infinite amount of data into, are there apps that we're adapting? Should we be adopting a standard app that allows us to do this right on our cell phone?
You can go to your page where it says emergency contacts, and you can put in your medications there. The only problem sometimes is that you may not have your phone with you.
Yeah.
But it is a useful tool.
If you do that, do you lock it out when you have a code, or is that always available?
You hit emergency, it's always available.
Okay, so you do have to be careful about that.
Yes.
As most people put a security code on their phone, you don't want to put it in notes where you're going to lock it out of
people
of the doctors
obtaining the
may want it.
information.
And you may be unconscious when you are in the...
And nobody wants to think this way, but accidents do happen.
We wear a seatbelt when we drive in the car because we know that can save our lives.
Right.
This is another thing we can do
To help
save our lives.
give your physicians
Absolutely.
the opportunity to help you.
Absolutely.
That is a good note to end things on. This is another way to
important.
help yourself.
Exactly.
We can't control everything, but the things that we can control, we should do
Absolutely.
to keep ourselves healthy.
And if you can do that all in a time before a crisis strikes, you'll be in better shape.
You'll be better prepared.
Absolutely.
Very, very wise information, Bob. Unfortunately, we've run out of time. I want to thank our very popular guest, Bob Bepko, for joining us on the set today, and again, providing all of us with, I think, important and generalizable information.
Very relevant.
Very relevant to all of us.
If you have comments or questions for us, please do email them to us at healthtalk@wchn.org.
Andrew and I would just love to hear from
would
you.
love to hear from you.
So thanks for watching.
Stay well.